My name is Dr. Kathleen Bergquist, and it is my distinct pleasure and honor to be able to share a brief paper with you regarding unseen victims of COVID-19. The COVID-19 pandemic has exposed vulnerabilities in all of the systems that provide societal structure and function globally. Healthcare systems were and are overwhelmed with overflowing emergency rooms, insufficient personal protective devices, and life-sustaining equipment. Schools and universities have had to find ways to adapt quickly, developing infrastructures for online instruction, and the economic livelihoods of billions were shut down seemingly overnight. The pandemic has laid bare inequalities as those who live at the economic margins have been disproportionately harmed, particularly in poor and immigrant communities in the United States. This paper considers the impact of the pandemic on arguably the most vulnerable, children at risk of abuse and neglect, or who have lost parents due to COVID, and the challenges of child welfare and other systems to protect them, both in the U.S. and globally. It is difficult to know the actual impact of COVID on families and children, but practitioners and researchers fear that children will be at greater risk. In the United States, the digital divide has been amplified as the schools have had to rely on virtual instruction. Children in underserved or poor communities often do not have internet access or are limited to mobile hotspots and smartphones, rather than laptops and tablets. School districts have reported that many children are simply disengaged, whether because of technology or overburdened parents who are unable to provide needed oversight and instructional support. Food insecure children who rely on school-based lunch programs struggle to provide appropriate nutrition. Food insecure families who rely on school-based lunch programs struggle to provide appropriate nutrition to their children. The economic fragility of families has been amplified as parents have lost their means to support their children, have become incapacitated by illness or death, or forced to quarantine and care for family members. This is particularly salient for those who do not have the option to work from home and are predominantly in low-paying service or production industries. The loss of a wage earner, concluded by whatever means, exponentially increases the stress on a family system. A recent study concluded that as of February 2021, almost 40,000 children in the United States have lost at least one parent due to COVID. 55% were non-Hispanic Black children. According to the Centers for Disease Control, racial and ethnic minority groups in the U.S. are at a greater risk of contracting COVID-19 due in part to difficulties in accessing health care, being essential workers in industries such as public transportation, retail, factories, farms, or healthcare, and living in crowded housing. The cumulative stress and social isolation is tolling a price. Most frightening is the projection that abuse and neglect in already stressed families will increase, but go unnoticed and unreported. Preliminary studies have garnered conflicting results as to the prevalence and severity of child maltreatment reports. Chapin Hall found that reports were 40 to 60% lower in a period of 2020 than in the same period in 2019. They have hypothesized that the decrease in reports likely does not correlate with decrease in maltreatment. Rather, the data reflects the fact that the children home from school have diminished exposure to adults who might detect and report abuse and neglect. Differing reports from emergency healthcare systems have provided conflicting patterns. For example, the University of California's San Francisco's Children's Hospital and the Children's Mercy's Kansas City Hospital found a steep decline in the number of ER visits and hospital admissions, and that the severity of injuries to be unchanged from pre-pandemic levels. However, while child abuse reports and emergency room visits have declined, children are being admitted for more severe injuries or are dying at a higher rate secondary to maltreatment. It is probably too early to get a clear picture, and the conflicting reports may reflect regional differences. However, maltreatment reports and hospital visits may be decreasing because the safety net for protecting children has been eroded due to stay-at-home orders. Additionally, there is an increased inability or reluctance to seek medical care except for in extreme circumstances due to COVID-19 protocols and restrictions. Some have suggested that the decrease in child abuse and neglect reports may be attributable to drop in low-risk referrals, which may be an appropriate correction of the child maltreatment reporting system. The pandemic may shed light on the need for increased prioritizing of support and help to stabilize families rather than overreactive supervision by mandated reporters. Several policy centers have offered guidelines and suggestions for child-serving institutions to adapt service provision in response to the pandemic and to position the current crisis as a stress test and opportunity for reform. Hurd, Connell, Dupree, Jackson, Knoll, Lee, and Mason suggest in a policy brief reconstructed safety zones for children that include innovative strategies for child safety checks, increased training for recognizing and reporting maltreatment for those who are not mandated reporters, for example, families, friends, and community members. A particularly important recommendation is shifting focus from surveillance to providing assistance and support with a goal of reducing risk. The over-monitoring of racial and ethnic minority groups, especially as it pertains to poverty-related neglect, has been critiqued as a function of systemic racism. Kaiser et al. Suggest that economic interventions to include the Coronavirus Aid, Relief, and Economic Security Act and eviction moratorium may have been pivotal in relieving family stress that might contribute to increased child maltreatment, which is congruent with an assistance and support approach. Similarly, Weiner et al. Recommended differentiating between poverty-related neglect from child abuse, making it easier for child welfare agencies to more accurately target interventions that could decrease removal and better support families. To that end, Font recommends increasing the capacity of community partners to address non-abuse referrals, thereby decreasing an overburdened child protection and child welfare system and preserving families. In the United States, the pandemic has strained institutions and systems, and we are just now seeking lessons learned and considering long-term impacts. Children are inherently the most vulnerable in our communities, and it is imperative that we take stock and know that we can and will be better prepared for the next pandemic, hurricane, or other yet unknown crisis. Similar to insights gained from intercountry adoption research, at the moment that parents, families, and communities are seeking to rebuild after a war or a natural disaster, the goal should be stabilization and not removal. It is the sharing of knowledge and practical experience through global platforms such as this that ensures that we prioritize the best interests of children. Thank you for the opportunity to share my thoughts.